The neck examination consists of several key techniques that help identify normal structures and potential abnormalities. Begin with visual inspection, observing the neck for symmetry, visible masses, abnormal pulsations, and any unusual skin conditions. Pay special attention to the position of the trachea, which should be midline. Any deviation may indicate a mass or other pathology. Next, perform palpation with gentle fingertip pressure to assess tissue mobility and identify any masses or tenderness. Always palpate both sides of the neck simultaneously for comparison, noting any abnormal findings. Patients should report any areas of tenderness during palpation. Evaluate range of motion by having the patient flex their neck forward, extend backward, and rotate side to side. During range of motion assessment, note any limitations, stiffness, or pain, which may indicate muscle strain, arthritis, or other neck pathologies. Observe the jugular veins with the patient positioned at a 30 to 45 degree angle. Jugular vein distension may indicate cardiovascular issues. Normal jugular veins should not be visibly distended at rest. If distension is present, note the highest level visible on the neck. Throughout the examination, be alert for abnormal findings that require further assessment. These may include tracheal deviation, limited mobility, or unusual masses. Document any abnormalities with specific details about location, size, consistency, mobility, and associated symptoms. These findings may require further diagnostic testing. A thorough neck examination helps identify a wide range of conditions, from simple muscle strain to more serious concerns like masses or vascular abnormalities. Lymph node examination involves systematic palpation of approximately 10 different node groups in the head and neck region. Here are the key lymph node locations that should be examined during a comprehensive assessment. When examining lymph nodes, use the pads of your index and middle fingers to apply gentle circular pressure. Begin with the preauricular nodes located in front of the ears. Next, examine the postauricular nodes found behind the ears. The occipital nodes are located at the base of the skull. Palpate the submandibular nodes found under the mandible. Check the submental nodes under the chin. The anterior cervical chain runs along the front of the sternocleidomastoid muscle. The posterior cervical chain is located along the back of the sternocleidomastoid muscle. Examine the supraclavicular nodes located above the clavicle. Finally, check the infraclavicular nodes found below the clavicle. For each lymph node group, assess several key characteristics. Evaluate size, measuring any palpable nodes in centimeters. Note the consistency, whether soft, firm, or hard. Check mobility by determining if nodes are fixed or freely movable under the skin. Assess for tenderness during palpation, and determine if nodes are discrete or matted together. Understanding normal lymph node characteristics is essential for identifying abnormalities. Normal lymph nodes are typically non-palpable or small, less than 1 centimeter in diameter. They should be mobile when palpated, not fixed to surrounding tissues. Normal nodes are discrete, meaning they are separate and not connected to each other. And they should be non-tender upon palpation. Perform lymph node examinations systematically to ensure all node groups are properly assessed. When assessing older adults, you should be aware of several normal age-related changes. The thyroid gland typically undergoes atrophy with age, becoming smaller and less palpable. Lymph nodes may show diminished reactivity due to a natural decline in immune response. The neck tissues generally become thinner, making structures more prominent but not necessarily abnormal. Let's examine abnormal lymph node findings that warrant further investigation. Normal lymph nodes are typically less than 1 centimeter in size, mobile, non-tender, and distinct. Enlarged lymph nodes greater than 1 centimeter are considered abnormal and require further assessment. Fixed or immobile nodes that cannot be moved during palpation may indicate infiltration of surrounding tissues. Lymph nodes that are tender to palpation often suggest an inflammatory or infectious process. Matted nodes that cannot be distinguished individually are particularly concerning and may indicate malignancy. These abnormal findings may indicate various conditions, ranging from localized infection to systemic disease or malignancy. Now let's review abnormal thyroid findings that require further evaluation. An enlarged thyroid, or goiter, is visible or palpable as an increased size of the entire gland. This may be associated with hyperthyroidism, hypothyroidism, or other thyroid disorders. Thyroid nodules appear as distinct lumps within the gland tissue. While most are benign, they require evaluation to rule out malignancy, especially if they are firm, fixed, or growing rapidly. Other concerning thyroid findings include asymmetry between the lobes, tenderness during palpation, and fixation to surrounding structures. Proper documentation and reporting of findings is essential for clinical decision-making. Document all findings precisely, noting the exact location, size in centimeters, mobility, consistency, and any tenderness. For example, a concerning lymph node might be documented as right cervical lymph node, 2.3 centimeters in diameter, fixed to deep tissues, firm and non-fluctuant with minimal tenderness. Patient reports night sweats. Prompt reporting of significant findings is essential, as they may indicate serious conditions ranging from infection to malignancy. When nodes are hard, fixed, or persistently enlarged, they require immediate attention and potential referral for further